Hi, I'm Tessa.
Hi, I'm Bailey.
And we're with On-Spot Therapy and Orofacial Myology. We would like to talk to you about tethered oral tissues, also known as TOTS, and you may have also heard tongue and lip ties. What are TOTS, or tethered oral tissues? You may have not heard that term before, but what it includes is the frenum under the lip, which if you flip your lip, it's that little piece of tissue, or under the tongue, that little piece of tissue there. Also, you can have cheek or buccal frenula too that are larger. They are the ones that often don't impact feeding as much as a tongue or lip tie, but they are also present occasionally on the upper and lower gums and cheek area. So those little pieces of tissue can sometimes be a little too tight and impact how the tongue, the lips, or the cheeks are functioning. There are a lot of signs and symptoms that go with tongue and lip ties, and new moms may not always be aware of these. So we're going to kind of touch base about all the signs and symptoms that infants experience as well as mothers when they're breastfeeding. So the first signs and symptoms can be that the baby is fussy, gassy, kind of colicky, frequently spitting up, or having excessive hiccups. The other symptom could be that they have a very poor latch or it's very shallow. Sometimes the baby appears to have a good latch, but mothers report that they still don't feel that their baby has a good latch. Sometimes babies with tongue and lip ties will slide on and off the nipple repeatedly during feeds. And sometimes friction from breastfeeding can cause a little blister on their lip. So if you see a little blister on their lip and it stays present for a long time, your baby is rubbing that lip and causing some friction to cause a lip blister. Sometimes babies will have loss of milk during feeds because their latch and seal are not adequate. So occasionally moms will notice that the baby is constantly dribbling either from the breast or bottle feeding. And you might be aware of this, not always during a letdown, but it's kind of consistent throughout a feed. And it may cause you to need to put a towel or something under your breast so that your whole clothing does not get wet. So that would be also a sign. If your little one is biting or just chewing at the nipple and just mouthing it but not really sucking, that can be a sign that they're just kind of having a little difficulty with feeding due to a tongue or lip tie. Sometimes the babies will breathe through their mouth. Their tongue is low and forward, and their mouth is hinging open whether they're awake or asleep. Also, sometimes they have short sleep duration, and sometimes that's because their airway is kind of getting blocked by their tongue, and or they're not getting enough to eat because they're not able to draw the milk from the nipple. Another sign can be poor weight gain, and this is seen often with breastfed babies, primarily who have tongue and lip ties, and that is because they are not drawing out enough milk to adequately feed themselves. And so sometimes they feed more frequently, but some babies, they fatigue at the breast and fall asleep, so they won't get enough nutrition, so then their weight starts falling off the scales. So if your baby, you're told that your baby has failure to thrive, that would be a red flag for a tongue or lip tie, and you should definitely get an assessment.
All right, continuing with infant signs and symptoms. The infant might fall asleep during feeds. That is just because it is a lot of work for them to get that suck, so it's tiring and they will fall asleep due to fatigue. There may be gagging, sputtering, or coughing during feeds because of the inability to manage the milk flow or poor tongue coordination. There may be reflux, difficulty flanging lips out. So if you notice that your baby's lips are tucking inward, it's most commonly on the upper lip. And at rest, if your baby's lip form the shape of a tent, that is another sign and symptom. Clicking or smacking noises during feeds. Noisy breathing or snoring. That would be, for example, the tongue has the inability to elevate, so it's resting and going more towards the back, which is blocking the airway. Frustration during feeds, whether that be the milk is coming out too fast or it's not coming out fast enough. nasal congestion, where that acid reflux may come back up out the nose, or a pacifier falls out easily because they have the inability to create the proper suck.
So those are all the signs for your infant, but what signs may mom be experiencing if she is breastfeeding? The mother may experience pain during the feeds, not just initially, but typically throughout the duration of a feed. And that is because the baby is not able to draw the nipple in far enough, and so it's hitting their gum ridge and it's causing trauma to that nipple. So it can cause lipstick-shaped nipples, and overall generally just be very painful, and what mothers and I would have described toe curling pain. Sometimes the nipples will even bleed, and of course talking to lactation about using some ointments and stuff can be very helpful, but will not resolve any tethered oral tissues. Sometimes moms will get plugged milk ducts, and it may lead to mastitis. So if you feel like your milk ducts are plugged, or you do get mastitis, there's a good chance that your child may have a tongue or lip tie. Some moms get an oversupply of milk, and that is because the baby is nursing so frequently that it just continues the stimulation of milk production, and that leads to being very uncomfortable, which can also lead to the clogged milk ducts and mastitis. Some moms will say, oh, I just didn't make enough milk. Well, often tongue and lip ties contribute to kind of that lack of stimulation, and so the milk production just isn't there. And so if you feel like you have an undersupply of milk, that would be a very good reason to get an assessment as well. Also needing to use a nipple shield for baby to latch better. That's something that we use as a compensatory tool to get baby to breastfeed and to make it more comfortable for mom. It doesn't always work, and it doesn't always solve the problems, but it can be helpful in transitioning and trying to get to the root of the problem. So tethered oral tissues, there are a lot of providers who sometimes miss the signs and symptoms. So pediatricians occasionally, will let mom know that it looks fine, but then I see the moms and they report, well, the pediatrician said that there's no tongue or lip ties. So at On-Spot Therapy, we will do a functional assessment where we go and look at your entire baby's mouth, the face, lip, cheek, jaw, tongue, muscles, and make sure they're all either not too tight, not too weak, making sure the mobility is there. We're just generally looking overall how all of their oral and facial muscles are working. We'll assess their suck. We'll determine based on severity of symptoms, and then we'll also look at the little frenula, which is the lip is right here. So if you flip your lip, that little tissue is the lip, and sometimes it's just so tight that the lip cannot flange on the breast. And also under the tongue. So if you suction your tongue and you can see that kind of string, that is the lip frenula, and the tongue frenula, and that can also be tight and hinder the baby's ability to elevate their tongue and then to draw the nipple in and draw the milk out from the back with a nice wave-like motion. So those are all reasons that you would want to reach out to a speech-language pathologist who is well-versed in orofacial myology for an assessment of oral function and determine whether the tongue and lip frenula are too severe and that a release would be recommended, or if some therapy can help, just working on the muscles. And it is especially important to prep those muscles for a release if your baby is tongue or lip tied to have the best outcome, because there are other involvements after a release, such as doing stretches, and if those aren't performed, the tissue may reattach and you may need to get another release. Not all babies need releases, but that's why we look at the function and the impact of their feeding abilities and how the mother is doing with feeding, whether it's breastfeeding or bottle feeding. And we definitely support mothers with whether they choose to do either. So what we do is we help moms. We look at the overall picture from birth to now, And we look at the structures and assess the function, and we determine if it's best for your little one to do therapy and get released, or just do a little therapy and hopefully get you back on your journey to smooth breastfeeding and feeding your baby. Thanks for listening. Again, I'm Tessa.
And I'm Bailey.
And we're with
On-Spot Therapy and Orofacial Myology.